Hello, Ejao Martins, licensed marriage family therapist, couple therapist. So, some friends of mine have asked how to best shop for a couple therapist. Well, I have been the receiver of the service before, and I'm a provider for couple therapy. So, I think I have something to say about this process, and I would like to give you some insider tips. So it is very different to choose a couple therapist from individual therapists because there are at least two people involved in this process. And you may have very different values and preferences and ideas about what couple therapy is and what's important to you. So the process of shopping for couple therapists is a test in some way for your negotiation and collaboration skills. So I can walk you step by step about my thought process when I look for a couple therapist. And then I will give you more blur on what a couple therapy is and why it's different and what is especially important to consider and for people who are not familiar with that. So number one that comes to my mind is what's your budget? How much money are you willing to spend or invest in your relationship? That really decides the cadence and duration and the outcome of your couple therapy sessions. So in the Bay Area, the average cost of a couple therapy session is from $200 to $350. Sometimes it's higher. It depends on the credential, the expertise and experience of a couple therapist, and the time. So a couple therapy session can range from 50 minutes, 70 minutes to 90 minutes. And it's really important when you're interviewing couple therapists, you want to ask, what is your fee per session and how long is a session? So the second question will be, well, how are you going to pay for that? Are you going to use insurance and you want the insurance to cover most of the cost? Or you have some room to pay out of pocket? Or maybe something in the middle that you can pay some and you want an insurance company to cover some. So in the first scenario, you want to look at your insurance company's website and call the network providers, in the network providers. Please check with them because sometimes insurance company doesn't really update their in-network provider list. So call to verify. And also if you wanted to use your insurance to reimburse for out-of-network providers, you may want to ask a therapist when you're interviewing them, do you provide a super bill? Are you familiar with the diagnosis code for couples therapy? That is a specialized area which is different from individual therapy. So how they bill and what code they use can impact how soon and how much sometimes you get reimbursement from an insurance company. If you don't want to worry about it, you just pay out of pocket. That might be easier, but it can be also very costly. So the number three question I will ask you is, what is your desired outcome? There are all kinds of couple therapy. There's the solution focused, the brief, short-term couple therapy. It's more like a crisis intervention. And there could be also psychodynamic oriented long-term couple therapy. And sometimes most of the time it's more in between. It can last from a couple months to years. So you just want to stop fighting? See, if you involve in a domestic violence situation, you just want to stop fighting and have better communication and want a short-term work. Or you want to have a more fulfilling relationship, better connection, increased intimacy, which is more like a long-term goal. Or sometimes couples come in for premarital counseling, they just want to spend 8 to 10 sessions to figure out if they're compatible and iron out some major differences and build some skills for problem solving. So knowing what you want really help you to budget and help you to stay focused on your goals. My fourth question for you is, what is important to you? For both of you or all of you. There are a couple factors I'm listing for you to consider. Location. If you really strongly prefer in-person sessions, you may want to know where the location is, the couple therapist office, and if it's convenient for you. And if you prefer the virtual flexibility, that's also good to ask. Do you provide virtual sessions? I know some couple therapists have preference for in-person or virtual, but some of them do both. Schedule. Is there any particular time you have in mind for couple therapy? That's especially important for a family with young children. And they prefer time when children are in care or in school, so they can have alone time with each other for some work. Flexibility. Couple therapy calls for flexibility, but not all couple therapists have the flexibility in their schedule, or they choose to have a really full schedule that they don't have a lot of room for rescheduling. For clients who have young children or have a very demanding work schedule, they may need to reschedule. Sometimes you need to ask if the therapist has some flexibility in doing so. Culture and language. If you feel strongly about having a therapist, know your culture or understand mixed culture marriages or relationship, and speak certain language or at least understand the background of that language. That's very good to keep in mind to make you feel more comfortable and more safe with a certain therapist. Gender and sexual orientation. If that's important for you to feel comfortable and aligned, that's a factor to consider as well. The next factor is more for more therapy savvy clients, modality. Certain kind of clients are very knowing themselves really well, that they respond well to certain modality like emotional focus therapy, internal family system, or some attachment-based therapy. And it's important to spell it out in consultation to know if this will work for you, this couple therapist. Next factor is expertise. If you come in with a particular issue in mind, like ethical non-monogamy, ADHD, neurodivergence, infidelity, transgression, or with young children, culture adaptation, integration, you wanted to find an expert in this field to understand and help you, because it's a specialty in specialty. The last one I can think about is experience. It ties into the budget in some way. For certain clients that they don't want to spend a whole lot and they wanted to really consider their budget, and they're happy to see an intern or someone is in the process of getting a license with a sliding scale. Others are really, because of their complexity of their challenges, they really need someone who's very experienced and licensed. And my fifth question for you that we can elaborate more is, if you have been in individual therapy or couple therapy, what has worked for you, what hasn't? If you're new to couple therapy, you may want to ask the couple therapist, are you willing to walk us through and train us, that we don't have any experience in this? Can you provide more explanation on the process and the stages, and to help us to understand where we are so we don't feel at loss? Couples therapy is very different from individual therapy. It has at least 2 clients involved with totally different, sometimes, personalities and preferences and values. And they may have preference for the couple therapist as well. A couple therapist traits or personality traits or styles I want to introduce to you for you to consider. And the reality is that the 2 of you may have totally different preferences, and you may have to discuss and compromise to look for the therapist that work for you. Couples therapy by nature is structured and calls for therapist leadership. So in order for couple therapy to be more successful, the therapists need to be more directive and comfortable with their leadership. And one example is if you can see the couple come in and to rehash their past hurt and fight and start get very excited and start fighting or bickering. If the therapist is very laid back and very quiet and doesn't come in and doesn't feel comfortable in their leadership, they can just let it go on. Like in that movie, You Hurt My Feelings. And the clients will just repeat what they do outside of the session, which is not very productive and cost effective. So on the spectrum of, from the left side is more supportive, nurturing, reflective, and quiet and reserved. To this spectrum is more directive, containing, structured, and active. Couple therapists generally will be more on this side in order for it to be successful and effective for clients. But a good couple therapist will adapt to clients' needs and balance between nurturing and pushing, like a good parent, to really see you, your hurt and pain, and validate each of you without bias, and to push you to work with your discomfort and try something new so you can achieve the outcome that you desire. So it's good and important to ask your couple therapist in your interview or consultation what kind of style, what kind of modalities that the couple therapist is using, and to really think about if that will work for you or not before you start sessions. Okay, I hope this is helpful for you. And if you have any questions and comments, please leave a note, comments down below. And if you like what I say, like this video and subscribe to my channel. Until next time.